Hi everyone, my name is Sheridan Lessons and my teammates are Taylor Murphy and Jonathan Glavich. We are three occupational therapy graduate students at Towson University enrolled in the 612 OT community course. During this course, we have created a series of ergonomic training videos to assist students and faculty at Towson University who have transitioned to virtual learning this year due to the COVID-19 pandemic. In this training video, I will discuss occupational therapy's role in ergonomics and why using proper ergonomics is important. I will also highlight a few common musculoskeletal conditions of the upper extremities that can be developed from prolonged computer use. I will then share a guided stretch video for the upper body to use to help reduce upper extremity pain and discomfort. So before getting started, this is just a disclaimer that this information is for general purposes only, and you must adhere to any individual precautions you need to follow and seek specific information from your healthcare professional if you have any medical concerns. So why is this important? Occupational therapy has an important role in ergonomics given our profession's focus on helping individuals, groups, and communities participate in daily activities. To further support our role in ergonomics, we have provided a quote from the American Occupational Therapy Association, which reads, "For individuals as well as groups of people whose ability to perform their various life roles is affected by illness or injury, the occupational therapy practitioner is well equipped to facilitate the successful return to optimal function through the use of education, intervention, and adaptation." In this video, we will help computer users who are experiencing upper extremity musculoskeletal pain and discomfort from prolonged computer use. According to the Occupational Safety and Health Administration, also known as OSHA, working in awkward body postures and performing the same or similar tasks repetitively increases a worker's risk of injury. Work-related musculoskeletal conditions can be prevented through proper ergonomics, which helps lessen muscle fatigue, increases productivity, and reduces the number and severity of work-related musculoskeletal disorders. Excessive computer use can be linked to musculoskeletal conditions in the upper body. Three common conditions related to computer use are carpal tunnel syndrome, osteoarthritis in the CMC joint, and de Quervain's tenosynovitis. Carpal tunnel syndrome is developed from a pinched nerve in the wrist, specifically the median nerve. It can lead to numbness, tingling, and pain in the thumb, index, middle, and half of the ring finger. This occurs when the wrist is bent for a prolonged period of time, for example, when using the keyboard at your computer. Occupational therapists can address carpal tunnel syndrome through stretching and splinting. Individuals with carpal tunnel are recommended to wear a volar wrist immobilization splint, which you can see on the slide. This can be made by an occupational therapist or other hand therapy specialist to help stabilize the wrist and reduce pressure on the medium nerve. Prolonged computer use can also be a risk factor for developing osteoarthritis in the wrist or CMC joint. This happens when the cartilage that covers the ends of the bones starts to wear away, and this can cause pain and stiffness because the bones start rubbing against each other as their protective barrier is worn down. Repetitive movements from a lot of hand work can be a risk factor for osteoarthritis as it puts more wear and tear on the wrists. Occupational therapists can help reduce pain and discomfort through joint immobilization with a splint. Osteoarthritis is commonly first noticed in the CMC joint, which is in the thumb. So the photo displayed on the PowerPoint is a hand-based thumb immobilization splint to help immobilize the thumb and reduce pain. De Quervain's tenosynovitis is another condition that can be caused by repetitive movements or overuse of the thumb and wrist, which can occur from excessive computer use, especially typing. The barrier that surrounds the tendons that runs between the wrist and the thumb become inflamed, which causes pain and discomfort. To help reduce pain, occupational therapists recommend immobilizing the thumb and wrist with a customized forearm based thumb immobilization splint to keep the thumb and wrist straight in order to rest the tendons. And this is seen in the third photo on the slide. Next, we're going to move into stretches for the upper extremities. Stretching can be used throughout your day to help reduce pain and discomfort related to computer use. An ergonomic study conducted in 2016 found that engaging in stretching exercises can help improve flexibility and strength while preventing musculoskeletal conditions related to the neck and shoulders. So I'm going to share an upper body stretch routine that I filmed. Performing the stretches outlined in this video about 3 to 4 times a week can help reduce the risk of developing musculoskeletal conditions and overall reduce pain and discomfort. And this is a guided video, so you can perform the stretches along with the video. Okay. Hi everyone, today we're going to do a quick upper body stretch routine. We're going to focus on the neck, the shoulders, and the wrists and the fingers in this video. So let's begin with the neck. So you're going to interlock your hands and place them on the back of your head, and then gently pull your chin down, just like that, and we're going to hold that for 15 seconds, okay? Okay, you should have felt that in the back of your neck. Next, we're going to do a neck stretch on both sides. So you're going to reach your right hand over your head, then shrug your left shoulder. And you're going to slowly pull your head away from your left shoulder, and then drop your left shoulder. You should feel that stretch right when you drop your shoulder. All right, I'm going to hold this. Okay, now we're going to do the other side. So with your left hand, side of your head, you're going to shrug your right shoulder. Slowly pull your head down, release the shoulder. You should feel that stretch. Okay. Now we're going to stretch from side to side, so slowly turn your head to one side until you feel stretch. And we're going to do the other side, okay? Just like this. And come back forward to the other side. And come back forward. Okay. Now we're going to move on to some shoulder stretches. We're going to begin with a shoulder pull. So you're going to grab your right upper arm and pull the arm at shoulder height across your chest and hold this for 15 seconds. Just like this. Okay, I'm going to do the same thing with the other side. So grab your left hand and pull across the chest just like this. And hold that for 15 seconds. Okay. Now we're going to do a triceps and shoulder stretch. So you're going to reach behind your head with your left elbow bent. You're going to use your right hand to push downwards on that elbow. So your hand moves further down your back. And try to keep your chin up during this. Have it like that. Try to keep it up. We're going to hold this for 15 seconds. Okay, now do the same thing on the other side. With your right elbow bent, grab it with your left arm, and hold. Now moving on to the wrist and fingers. We're going to begin by just kind of like shaking it out. So with your hands out in front of you, we let your hands go limp and then just shake it out. This can be repeated throughout the day, like when you're staying in the same position for too long, helps get the blood flowing. Now that we've shaken it out a little bit, reach your right hand out, grasp it, and then slowly bend so you feel stretch. Just like okay, and now we're going to do the left arm. You're going to pull with your right hand, okay? Just like that. Good. Now for a little bit the fingers. So we're going to start with your palms facing down and make a fist. Just like this. Straighten them out. Fist. Now when you go out, we're going to do half a fist. Just like that. Fist. Half a fist. Hold. Fist. Alright. And then we're going to end with some thumb touches. So hold your hands outwards with your palms facing towards the ceiling. And then touch your thumb to the tip of each finger. Just like that. Check it out. All right, thanks guys. So you can use this routine throughout your day and can repeat it as many times as needed. So thanks for watching. Okay, so these types of stretches can be used throughout your day. Like I said, when you find yourself using your computer for prolonged periods of time. Another ergonomic study from 2017 emphasized the importance of using stretching exercises, but in combination with ergonomic modifications. So, although it is important to participate in these exercises, it is also recommended to make the necessary ergonomic modifications to your workspace. We will discuss some ergonomic modifications in another video in our ergonomic training program, so that will be available for you to review as well. So lastly, I just want to thank you for listening to this presentation today. And if you have any questions, please contact me or one of my teammates at the emails listed below.